Now, just to wrap up the meeting, today we started unloading the burden of vitiligo with a session on outcome measure, where a lot of discussion was surrounding VASI, FVASI, and then also the new VIDA and vitiligo sign activity score. And we had a very interesting talk by Nania Vanjil, where she gave us an overview of these outcome measures, like comparing his vitiligo extent score. And I think in future we will be having a more computerized, more precise outcome measure, because that is the need of the hour. Then we move to a session on basic sciences with very important presentation on the implication and the risk of for non-melanoma skin cancers, and a presentation on house dust mites, and also on immunohistochemical and tissue expression of mortellin in vitiligo patients. Then there was very important session by the patient support group. So this is very important connecting link between our final ultimate destination of completely finishing the burden of vitiligo. So probably that was very exciting session, where we had viewpoint from the VPOC and patient support group, and how this dermatologist and VPOC and other patient support group can work together for our ultimate aim of an ideal treatment of vitiligo. Then we just had our session on this medical management, where we have a very interesting discussion on pediatric vitiligo and other aspects of management of vitiligo. So now, on behalf of GVF President Dr. Amit Pandya, my co-chair Dr. Samia Esmat, and Dr. Iltfat Hamjavi, a big thank you for your active participation and input, engaging in such a fruitful, constructive and open exchanges throughout these 72 hours dedicated to vitiligo research. So we are looking forward for your feedback, so that we keep with this our journey towards our ultimate aim of completely finishing the burden of vitiligo disease. And I would like to invite you all to our next meeting, VIS at Cairo, which under the leadership of Professor Samia Smith. I'm sure this is going to be a meeting with like we have now more inputs and how we can make it more innovative. So I'm sure this is a very brightest phase for vitiligo research. Thank you all.